Hey everyone, this is Dr. Lloyd Stegemann from the Better Way Center in Corpus Christi, Texas. Wanted to talk with you about caffeine after bariatric surgery. It's a question that comes up quite frequently, and many programs have different philosophies when it comes to caffeine, both before and after a bariatric operation. So I'm going to tell you our philosophy and why we believe that, but I certainly encourage you to talk to your program because it may be a little bit different. I don't like patients on caffeine in that immediate phase before surgery. So when we have our patients start their 2-week pre-op diet, I will ask them no caffeine during that period of time. My primary reason for that is you go into a caffeine withdrawal for people that are regularly using caffeine. After about 3 days of no caffeine, you get pretty significant withdrawal symptoms. Typically, a very bad headache is what the most common one, but also just feeling nauseated and uncomfortable. I want all of that done before we do your operation, because once we do your operation and now you're not drinking caffeine, some of those symptoms can also herald a problem after the bariatric surgery. So I do ask patients to come off for 2 weeks before their operation. After their operation, one of the things to keep in mind is that caffeine is a diuretic, meaning that it makes you urinate more. In that early phase after bariatric surgery, regardless of the procedure, the hardest thing for patients to do is to stay up with their lipids and not get dehydrated, because you can't drink as fast or as much as you could beforehand. So you have to go much slower and constantly keep something with you. And so getting up to the 64 ounces, what is recommended for every adult in the United States, 64 ounces of fluid a day, is really a challenge for patients immediately after the bariatric surgery. So if they're drinking a fluid with caffeine, now they're going to be urinating more, and it's going to be even harder for them to stay up with their fluids, and they can often get dehydrated in that early phase. For me and our program, once patients are up to their 64 ounces a day, I am perfectly fine with them having caffeine in anything that they drink. There are certain amounts of caffeine that we don't want to go over. If they're having symptoms of palpitations, reflux, things along that line, then we might get off the caffeine again. But there is data to show that caffeine can be an appetite suppressant as well. So again, I don't mind them being on caffeine once they get up to their 64 ounces. A variable per program. I certainly encourage you to talk to your program about how they feel.